my name is Mackenzie, and today I'm going to be performing trach care and suctioning. It is January 23rd, approximately 11 o'clock. I'm going to, first I started out, make sure to assess my patient, respiration, lung sounds, make sure that they need suctioning. I'm going to go ahead and make sure that my suction works. So it looks like it's turned on 80 to 120 millimeters of mercury, which is exactly what we want. And I've got my suction here. My patient is in high Fowler's position. That is making sure that's going to help, help us with the trach suctioning and help with oxygenation. And then I also have a towel on her chest just to kind of help if any secretions were to get on her to help keep her clean. I've identified that this is my patient with 2 patient identifiers, and that we've also set a nonverbal form of communication. So if any time during the procedure she needs me to stop, she'll give me a thumbs up, and that's my cue. So we're gonna go ahead and get started here, but I've already got her hyperoxygenated. So I'm gonna wash my hands, and I got my 2 trays here. I got my trach care kit, and I got my suction catheter kit. So I'm gonna go ahead and open my suction catheter kit and put on my sterile gloves. And now, in my kit, I've got sterile water, and this is just going to be used to help clean out the suction catheter. So go ahead and pour that in here. And set that off to the side. I got my suction catheter in here. So I'm going to clean this as my non-dominant hand now, and I'm going to attach this to my suction, and hopefully that stays. Remove the oxygen from my patient and tell them that we're going to get started. So I'm going to make sure that my suction works, so I'll go ahead and try that out. Looks like it's working. So when I go advance into the trach, I want to make sure that my thumb is not on here. So I'm going to go ahead and advance. Okay. And when I hit resistance, I'm going to pull out intermittent suction and twist on my way out. Okay. Now I'm going to clean out my catheter nice and clean. I'm going to go ahead and go in again. Okay, intermittent suction and twist when I'm coming out. Clean it out, assess if I need to suction again, which at this time I don't, so I can go ahead and disconnect this. Get rid of this stuff. Take off my sterile gloves. Wash my hands and reapply the oxygen. And then I'll document what I got out after that's done. So now I'm going to clean the trach. So I'm going to open my trach care kit. This is also a sterile procedure, so I'm going to pull out my sterile gloves and put those on. Since I've already got my other sterile glove on, I can fix that. Get rid of this. And now in my sterile kit, I've got sterile saline and hydrogen peroxide, and you would pour half hydrogen peroxide, half sterile water in one, and just sterile water in the other. You're going to use this for cleaning. Since this is a mannequin, we can't actually use this on it, so we'll just simulate it. So now I'm going to use this as my non-dominant hand, and I'm going to take the oxygen off, which we had still been hyperoxygenating our patient. So oxygen's off. I'm going to go ahead and remove this soiled gauze pad and then discard that. And then now I'm going to use my sterile hand, and I'm going to take out the inner cannula. And I'm going to set that in the hydrogen peroxide. There are some cotton swabs in here. I'm going to use the sterile water and clean around the trach collar and just kind of get all the sputum off of there and discard that. And now I am going to clean, since this has been soaking, clean, and I'm only touching this outer portion with my non-sterile hand. Clean this really good and then rinse it. Okay, that's nice and clean. So now I'm going to reinsert this here. Okay, and then make sure that snaps into place, which it did. So that's the cleaning. We want to make sure before I put that back in, I would have dried it off with pipe cleaner. You want to try to get as least amount of water in the inner cannula as possible. Now I'm going to change the trach collar and apply the new gauze dressing. So I'm going to put this on. Okay, and I've got my new trach collar here. You do this one side at a time. This just helps to stabilize the trach. Okay, remove this other side. And then attach that and adjust it as needed. And apply my oxygen back to my patient and document everything I did. Thank you.